opposition coalition CUPP reject the move by the presidency to import Chinese doctors into Nigeria. The Nigerian opposition coalition CUPP, after reviewing the plan to import Chinese doctors by the President Mohamed Buhari-led government for no defined reason, and after consultation with the Nigerian Medical Association and reviewing their expert views, the opposition is of the informed opinion that the move is unnecessary, in bad faith, and a direct expression of loss of confidence on Nigerian doctors and other frontline medical health workers who have risked their lives daily despite the huge constraints and inadequacies they face to do a marvelous job of treating patients of the deadly virus with a very good success rate. Rather than import Chinese doctors into the country, the government could have shown support to the Nigerian doctors by providing adequate and sufficient personal protective equipment, PPE, for them to ensure that they are safe while doing their job. There are reports of doctors and other health workers in the University of Benin Teaching Hospital, University of Ilorin Teaching Hospital, University of Ibadan Teaching Hospital, Area Specialist Teaching Hospital, and the Obafemi Awolowo University Teaching Hospital, to mention but a few, already dangerously exposed to patients who have tested positive for the COVID-19. We asked the presidency, why did the government not work with our Nigerian Medical and Dental Council in line with the provisions of the law before coming to the ill-timed decision to import Chinese doctors? The Nigerian Dental and Medical Council Act provides that the council must be made aware and grant approvals before such steps are taken by government to bring in foreign medical doctors into the country to see Nigerian patients. The Nigerian Medical Association has rejected this move, and indeed all Nigerians should reject the move now. The opposition coalition stand with the Nigerian Medical Association in their decision to reject this ill-motivated move. The arrival of Chinese doctors in Italy unfortunately coincided with the spike in the contracting and death rates in that country, which made it to soon be the country with the most deaths. It could be a mere coincidence, but since the spike, what has this Chinese doctor done to improve situation in Italy with the thousands of deaths that have occurred since then? Are the Chinese doctors going to come to help us ramp up our recovery rate, which is very high at the moment? Are they coming to know why we are not dying like chickens, like it is happening in the United States, Spain, Italy, France, etc.? What will be the true mission of these Chinese doctors? Who has run real background checks on these doctors to ascertain their latent intentions? The pandemic is still killing people in China. They are still grappling with it. Where were these Chinese doctors when thousands of their citizens died from the virus? Are the agents of the Communist Party on a mission different from what they present? Must the federal government continue with actions that daily mortgage our country the more? Is the timing of this coming of the Chinese doctors at this point in time not very suspicious? Will these doctors not infiltrate our system and conduct unknown clinical trials on patients? The unanswered questions are legion. Everything about this importation or invitation of Chinese doctors by President Mohamed Buhari is totally rejected, as it is very dangerous, in violation of the law, a distraction from the good work being done so far, and a misplacement of priority capable of turning the table against Nigeria. As a matter of national security, the opposition rejects the plan by Buhari to bring in these Chinese doctors. Government must not at such a time express loss of confidence on its medical workers who are without relevant protection and are grossly underpaid, yet doing a marvelously well in a situation which has received international acclaim. The Nigerian Medical Association did not ask for the help. Neither are we aware that the Nigerian Center for Disease Control, NCDC, made a request for the Chinese doctors. The Director General of the Nigerian Center for Disease Control did not also claim that he did not get adequate experience from his recent visit to China. If the president has shut our air and land border on time, as we requested, the Italian and other index cases would not have landed. Or if the president enforced mandatory 14 days quarantine for all passengers from high-risk country, the cases of the community transmission being currently witnessed now will not be the case. The self-isolation policy employed by the government was weak, unserious, and lack of concern for the health of Nigerians. The president has since run under his bed for fear of contracting the disease. The president lost power and not the responsibility that comes with holding power. Please, President Muhammad Buhari, keep the Chinese doctors away from us and support our health workers with equipment, test kits, contact tracing logistics, and sustainable hunger fighting palliative, not the share to a few joke called social intervention palliative by the Minister of Humanitarian Affairs and Disaster Management. Let the world hear us clearly. Nigerians do not need the Chinese doctors' physical presence in Nigeria. There are technological means like teleconferencing, Skype, and all other types of video calls in use in the medical field, where doctors thousands of kilometers away are consulted to review and give expert advice on patient cases. Nigeria must leverage on such technology at this time. Even the World Health Organization is using Skype and teleconferencing. Nigerians will have no option but to hold President Muhammad Buhari personally responsible if he forces these Chinese doctors on citizens and the situation gets worse, or there are messy reports about unapproved action by these doctors. The president is the only head of state in the world today who has held up and hidden inside the presidential villa since the virus outbreak. He is the only president who is not constantly selling hope and reassurance to citizens, and he is the only president in the world who is not recognizing the near suicidal efforts of their country's health workers to contain this pandemic. Up to this moment, no health insurance scheme has been announced for our frontline workers who are risking their life day and night. But the president wants to fly in Chinese doctors into Nigeria. What incentive has the president provided for our health workers? Has he even said the words thank you to these lifesavers? Has the president called on citizens to appreciate them? Rather, he passes a vote of no confidence on them with an ill-timed, thoughtless, and morally damping move to bring in Chinese doctors. If President Muhammad Buhari wants the Chinese doctors for himself and his family in the villa, he has always sought foreign medical treatment. That is his problem. But for Nigerians, we are comfortable with the work of the Nigerian doctors, like we've always been, and we will resist anyone who wants to ridicule their good work. But the presidency must ensure that when their doctors from China come for them, they must be compulsorily isolated for the mandatory 14 days to be sure they will not carry a different strain of the disease into the country. Let it be known that there is a national health method we are following, a national health guideline that requires 14 days quarantine for people from high-risk countries that have been infected with the coronavirus. If the Chinese doctors President Muhammad Buhari is bringing, whether for himself or for anybody, these doctors must be confined to 14 days quarantine before this Chinese doctor will be allowed to mix with the general public. Mr. President, every good thing you touch goes bad. Please, leave Nigerian doctors alone to continue their good work and keep the Chinese doctors for inside the Asoro Presidential Villa Clinic. Let them attend to you and your family.